Good morning, students. Welcome back to the chapter Test Measurement in Sports. Let's look into the subcontent that we have already covered in the last lecture. In the last class, we have discussed about general motor fitness test, which include 50-meter standing start, 600-meter run walk, sit and reach, partial curl up, push-ups for boys, modify push-ups for girls, standing broad jump, and 4 into 100-meter shuttle run. Apart from that, we have discussed about measurement of cardiovascular fitness, which includes Harvard step test and Rockport test. Rikli and Jones senior citizen fitness test. Today, in this lecture, we will be discussing about Rikli and Jones senior citizen fitness test. Even in old age, everybody wants to be able to continue to do what he wants, and especially without pain for as long as possible. It requires proper fitness during such age. In the beginning, there were not enough tests to assess the functional fitness among senior citizens. This test is also known as Fulleration Functional Test of senior citizens. So, owing to that, Rikli and Jones developed the Senior Citizen Fitness Test in 2001. This test is beneficial for various senior citizens. It helps the early identification of at-risk participations. Along this, it is significant to plan safe and effective physical exercise program for senior citizens because individual health and fitness level can be known better with the help of this test. The Senior Citizen Fitness Test is comprised of the following 6 test items. Let's discuss all the 6 items in detail. Chair stand test for lower body strength. Purpose. The main purpose of this test is to measure the lower body strength, particularly leg strength, which is usually required for various tasks such as climbing stairs, getting in and out of vehicle, bathtub or chairs. Equipment required: a chair with a straight back and a seat of at least 44 cm and a stopwatch. Instructions for participants: the participant should sit in the middle of the chair. He should keep his hands on the opposite side crossed at the waist. The feet should be flat on the floor. His back shoulder be erect, and repeat sit up and down for 30 seconds. Let's look into the procedure. Keep the chair against the wall. The participant sit in the middle of the seat. His feet should be shoulder width apart and flat on the floor. The arm should be crossed at the wrist and held close to the chest. From the sitting position, the participant stand completely up, then completely back down. At the start of the signal, this is repeated for 30 seconds. Count the total number of completed cycle stand. In case the participant has completed a full stand from the sitting position, when the time is finished, the final stand is counted in the total. Scoring. The score is the total number of completed chair stands during 30 seconds. The following table shows the recommended range for this test based on the different age groups. Let's look into the recommended norms for the chair stand test for men. According to the age from 60 to 94, this table shows the below average, average and above scores. For example, a participant between the age of 60 to 64, if he do less than 40 sit and stand, then we can call him as a below average. On the other hand, if a person do 14 to 19 sit and stand, we can call him an average. And if an individual perform more than 19, we can call him as above average. In the same way, once we get the score, with the help of the chart, we can make sure which level he is. Norms for women. Same as for the men, there are norms for women. For example, a woman between the age of 60 to 64, if she perform less than 12 sit and stand, we can call her below average. On the other hand, if she do 12 to 17 repetitions, we can call her an average. And in the same way, if she is able to complete 17 and plus sit and stand, we can call her above average. So this way, we can calculate an analysis and we can conclude whether the person, a senior citizen, is at what category. Arm curl test for upper body strength. The arm curl test is a test for upper body strength. It is a part of senior citizen fitness test. It is designed to test the functional fitness of senior citizens. Purpose. The main purpose of this test is to assess or measure the upper body strength and endurance which is required for performing household and other activities involving lifting and carrying things. These are those activities which we perform in our day-to-day life. Equipment required: 5-pound weight for women and 8-pound weight for men, a chair without arms and a stopwatch. Let's look into the procedure. To do the maximum number of arm curl that can be completed in 30 seconds is its aim. Arm curl is performed with the dominant arm side. That means if you prefer to do your day-to-day activity with the right hand, kindly prefer the right hand. Vice versa, if you are preferring left hand, then use left hand. The participant sit on the chair, hold the weight in the hand using a suitcase grip. It means the palm should be facing towards the body. The arm should be in a vertically downward position. The upper arm should not move, but lower arm should move freely. Curl the arm up, though a complete range of motion, gradually turning the palm up. When the arm is lower back through the complete range of motion, gradually return to the starting position. The arm should be completely bent and then completely straightened at the elbow. This complete action should be repeated by the participant as many as times possible within 30 seconds. Let's look into the scoring. The score is the total number of arm curls performed in 30 seconds duration. The following tables shows the recommended range for the test based on the different age groups and gender. As in table 6.5, we can see the recommended norms for arm curl test for men. It also shows a range of 60 to 94 years with three criteria: below average, average, and above average. In this, let's take the example of an age group 65 to 69. If an individual able to perform an arm curl less than 15, then we can call him as below average. If the same person is able to perform 15 to 21 complete arm curls, we can say he is having an average arm strength. Or if the same person is able to do 21 and more arm curls, we can say the person have strength which is above average. In the same way, we can also calculate the arm strength of women. Let's take the example from the table, an age group that is 65 to 69. If the woman is able to do an arm curl which is less than 12, we can call her having a below average strength. If the same woman able to do 12 to 18 arm curls, we can say she is having an average arm strength. Vice versa, or simultaneously, if she is able to do an arm curl which is 18 and above, we can say she is having an above average arm strength. So this way we can easily calculate individual to individual, depending upon the age and the numbers, what is the arm curl test ability among men and women. Chair sit and reach test. Purpose: to assess the lower body flexibility, which is important for good posture, for normal gait patterns, and for various mobility tasks such as getting in, out of the bathtub or chair. Equipment required: ruler, a chair with straight back, approximately 44 cm height. Procedure: the participants sit on the edge of the chair. Keep against a wall for safety purpose. One foot remain flat on the floor while the other leg should be extended, remaining forward with the knee straight. Heel should be on the floor and the ankle should be bent at 90 degrees. Place one hand on the top of the other with the tips of the middle fingers even. Now, instruct the participants to inhale, and as he exhales, reach forward toward the toe by bending at the hip. His back should be straight and heads up. Avoid any jerk or bounce and never stretch too much. Keep the knee straight and hold the reach for 2 seconds. The distance is measured between the tip of the fingers and the toe. If the fingertip touches the toe, then the score is 0. If they do not touch, measure the distance between the fingers and the toe, that will be the negative score. If they overlap, measure by how much will be the positive scores. Let's look the scoring. The score is noted down to the nearest of 0.5 inches or 1 centimeter, as the distance reached either a negative or positive score. Following table shows the recommended norms in inches for the test based on different age groups. Table 6.6 represent the recommended norms for sit and reach test norms for men. In this, we have an age category. We have three criteria for calculating the flexibility of the individuals. Let's take the example from the age group 70 to 74. If an individual able to stretch forward, but if the score remains -5, 3.5, then we can call them having below average flexibility. If an individual is able to stretch from 3.5, that is negative, to plus 2.5, we can call that individual is having an average flexibility criteria. And if the same individual able to stretch and able to get a positive score equal or more than 2.5 inches, we can say the man or that individual is having an above average flexibility. This way, from the score either in negative or in positive, we can able to calculate the flexibility of the individual with the help of these norms. Let's look into the norms for women. We will take the same age category, that is 70 to 74. If an individual score minus less than or minus 1.0, we can say that female or that woman is having below average flexibility. If the same female score in between minus 1.0 to 4.0, we can say she is having an average flexibility. And if she is able to score a positive which is equal to or more than 4.0, we can say she is having an above average in flexibility. So these norms help us to identify and calculate the range of flexibility among senior citizens for men as well as women. Back scratch test. Equipment required: a ruler. Procedure: this test is performed in standing position. Keep one hand behind the head and back over the shoulders and reach as far as possible down middle of your back. Your palm should touch your body and the finger should be downward. Then carry your other arm behind your back, palm facing outward and fingers upward, and reach up as far as possible, trying to touch or overlap the middle fingers of both hands. Fingers should be aligned. Measure the distance between the tip of the fingers. If the fingertips back scratch test touch, then the score is 0. If do not touch, measure the distance between the fingers, that will be considered as a negative scores. If they overlap, measure by how much, that will be considered as positive scores. Practice 2 times and then test 2 times. Let's look into scoring. Record the best score out of 2 tests to the nearest centimeter or half inch. The following tables show the recommended norms for this test based on different age groups. Table 6.7 recommend norms for back scratch test for men. In this table, we have age, we have criteria, that is below average, average and above average. Let's take one example, that is age group from 75 to 79. If a person is doing less than -9, then we can consider the person having a low flexibility, which is called as below average. The same person is able to reach more than -9.0 to -2.0, we can say the person having an average flexibility. And if the same person is able to do more than that and more than minus 2.0 and above, we can say the person is having above average back strength as well as flexibility. In this way, with the help of negative and positive scores, we can make out the criteria where that individual stands. Let's look into women's result. We take the same age group, that is 75 to 79 years. In females, if a person do less than minus 5, she is considered as below average. If she is able to do minus 5.0 to 0.5, it is considered as average. And if she is able to do more than 0.5, that is a positive score, she is considered having an above average back flexibility. So this way we can easily calculate the flexibility, the range of individual, whether a man or a woman, with the help of the test and with the help of the norms. 8-foot up and go test. This test is coordination and agility test for senior citizens. The purpose of this test is to assess speed, agility and balance while moving. These are important in performing various jobs which require quick maneuvering, such as getting off a bus in time and to answer the phone, etc. Equipment required: a chair with straight back above 44 cm height, a stopwatch, cone marker, measuring tape, and an area without any hindrances. That is, a surface which is clean and neat and which is stable in terms of walking and doing the activity. Procedure: keep a chair next to the wall and the marker 8 feet in front of the chair. The participants start completely seated and hand resting on the knee and feet flat on the ground. On the command go, stopwatch is started and the participant stand and walk or run at all as quick as possible to and around the cone and return to the chair to sit down. The time is noted as he or she sits down on the chair. 2 trials are given to the participants. Scoring: the best trial is recorded to the nearest of 1/10 second. The following table shows the recommended norms or ranges in seconds for this test based on the different age groups are: Table 6.8 recommend norms for 8-foot up and go test. For men, in this table we have age, we have criteria called below average, average and above average. Let's take an age group of 80 to 84, and if in case if an individual is able to complete that task in less than 7.6, he is considered a below average in terms of agility, balance, and if the same individual is able to do that activity within 7.6 to 5.2 seconds, then we can say the person is having above average. On the other hand, if the individual is able to do the same activity with the score of 5.2 seconds, then we can say the person is having above average in terms of agility, balance, stability. Let's look into the norms for the woman. Age 80 to 84. If she is able to perform the task in a score less than 8.7, she has been considered as an below average. If she is able to do this task with 8.7 to 5.7, then she is considered as an average. And she, if she is able to do this task more than 5.7 in terms of seconds, she is considered as above average. In the same way, with the help of this chart and with the help of the test, we can easily able to identify an old age person's agility, balance and coordination for an activity. 6-minute walk test. 6-minute walk test is designed to test the functional fitness of senior citizens. The purpose of the test? To assess aerobic fitness or aerobic endurance, which is important for walking distance, stair climbing, shopping and sightseeing, etc. Equipment required: a measuring tape and a stopwatch. Procedure: the walking distance or the course is marked, that is 40.74 meter or 50 yards in a rectangle area. For example, you can mark 45 into 5 yards or 45.72 into 4.5 centimeters. With the help of the cone, place the cone in a rectangular interval to indicate the distance covered. Efforts are made to walk maximum distance as quick as possible in 6 minutes. A practice trial is given to the participants to make sure that he or she understands the test correctly. He may stop anytime if he or she feels uneasy while performing the activity. Let's look into the scoring. The best distance covered in 6 minutes is recorded. The following table shows the recommended norms or ranges in distance to this test based on different age groups. Table 6.9 recommended norms for 6-minute walk test for men in meters. We take an example from this table which shows age and the criteria, that is below average, average and above average. The age group is 85 to 89. If that person is able to do less than 380 meters, then we can say this person stands with below average score. If the same person is able to do somewhere around 380 meters to 570 meters, we can say the man or that person is having an average score. Similarly, if the same individual is able to complete a distance of more than 570 meters, we can say the person is having above average. In the same way, we can calculate in terms of norms for movement. Let's look into the same age group, that is 85 to 89. If a female is able to cover a distance which is less than 340, we can say she is having below average score. If she is able to do 340 to 510 meters, we can say she is having average score. And similarly, if she is able to do a distance which is more than 510 meters, we can say she is having an above average score. In this way, with the help of this test, we can easily able to identify an individual functional fitness of moving forward, covering distance as quick as possible according to their age, according to their distance, and according to the criteria. Summarization of the topic. Before we summarize this topic, in this last part, we have completed Rikli and Jones Senior Citizen Fitness Test, designed by Rikli and Jones. let's look into the topic that we have completed in this unit. We have done general motor fitness test that include 50-meter standing start for speed, 600-meter run walk for endurance, sit and reach for flexibility, partial curl up for abdominal strength, push up for strength for boys, modify push ups for strength for girls, standing broad jump for explosive strength, and 4 into 100-meter shuttle run for agility. In the second part, we have done measurement of cardiovascular fitness, where we have used and applied and understood two test protocols, that is Harvard step test with long-term method and shortcut method, and Rockport test, which is also a method of calculating VO2 max indirectly. Then, in the last part, we have discussed in detail Rikli and Jones senior citizen fitness test. Let's move into few type questions. Let's read and understand each and every question properly. Question number 1. An instrument to be used for accurate measurement of anything. The options are A. Test, B. Evaluation, C. Measurement, D. None of the above. And the answer is a test, because test is the instrument that is used to measure something. Question number 2. Score given by an expert every time a test is done. Options are measurement, B. Test, C. Evaluation, and D. None of the above. And the answer is measurement, because the test, that score we get from the test, is called as measurement. Test to measure minimum muscular strength of among old age people is the test. Cross-Weber test, Alpha test, Rikli and Jones test, none of the above. And the answer is Rikli and Jones test, because the Rikli and Jones test is specifically designed for old age people. Question number 4. Test used to measure explosive power of leg jumping horizontal distance. And the options are standing broad jump, standing vertical jump, both A and B, or none of the above. And the answer is both A and B. Standing broad jump as well as standing long jump, both are used to calculate individuals' explosive strength. Next question. The ability of the heart and the lungs to supply oxygen, rich blood to the working muscle tissues, and the ability to the muscle to use oxygen to produce energy for movement is a cardiovascular fitness, physical fitness, muscular strength, or none of the above. And the answer is cardiovascular fitness, as the cardiovascular fitness is the ability through which the heart and the lungs work together to supply oxygenated rich blood to the working muscles, tissues, and ultimately to the cells, and where oxygen helps to do its activity properly. Next question. VO2 max stand for volume of air consumed per breath, volume oxygen consumed, maximum rate of oxygen consumption, or maximum rate of air consumed. And the answer is maximum rate of oxygen consumed, okay, per breath. Next question. Test is to measure the lower body strength, particularly leg strength, related to climbing stairs, sitting and out of the vehicle, is called as chair stand test, back scratch test, 8 foot up and go test, arm curl test. And the answer is chair, stand and test. This test help to measure the lower body strength, particularly to the leg, for senior citizens. Hardware step test is to measure what? Ankle strength, flexibility of the lower body, cardiovascular fitness, or strength ability. And the answer is cardiovascular fitness. As in hardwood step test, we use a step when we step up and step down, and then we look into the heart rate, and when we put into the formula, we are able to know what is the standard or the quality of our cardiovascular fitness. I hope you have understood each and every part in this chapter. Go through the chapter in the textbook, read it, and in the next class, come with the questions and queries. And be prepared for the next chapter, which will be beginning in the next lecture. Hope you have understood all the concepts properly and you are ready to go through each and every concept where which can help us to calculate the physical fitness of an school going students and a physical fitness of an old age person. Thank you very much to all of you for joining the class. See you in the next lecture. Have a nice day. Thank you very much. I will request all of you to exit the class, and thank you very much for joining the class. See you in the next class. Thank you all of you. Thank you very much.